Hi guys, and welcome to this class. And in this very video, we are going to be talking about the other types of anemia. I hope we will talk about at least 2 or 3, because I want us to do some anemia in a big way actually, and not in a just summarized way. But still, we have to do some in a summarized way, not to dwell too much on it. Because the types of anemia, none of them have the same thing, as in the same sign and symptoms and the likes. So, but the point is, let's try to distinguish better in some cases. So, but for now, without wasting much of your time, let's talk about the vitamin B12 or pernicious anemia. So, I'll be right back. You're welcome, guys. Now, let's start with vitamin B12 deficiency anemia. Vitamin B12 deficiency anemia. Cool. Now, what is the meaning of that? You don't have to strain yourself at all. Vitamin B12 strictly, you know that vitamin B12 deficiency means lack of vitamin B12. So if you are not taking in vitamin B12 in adequate amount, so you can actually develop what? Anemia, which is a reduction in what? In either the quality or the quantity of the red blood cells. Now there is a question I was supposed to ask in the last video about iron deficiency anemia. What do you think is affected? Is it the quality or the quantity of what? Of red blood cell in iron deficiency? What do you think is affected? The quality or the quantity? This is just the quality. So the hemoglobin is affected. So the production still continues. Now, let's leave that aside. The point I'm trying to make here is that when they say vitamin B12 deficiency anemia, it's a type of anemia that results due to what? A lack of what? Vitamin B12. Cool. Now, what are the causes? Do not stress yourself at all. It can be caused by autoimmune disorder. Now, the question is, what are autoimmune disorders? Now, the main cause of what? Of vitamin B12 deficiency anemia, I said, is auto now, immune disorder. Autoimmune disorder. And the question is, what does that mean? Autoimmune disorders, they are actually the disorders of the body, where the cells of the body are not able to recognize their own cell, and they kill the body cells. As in one group of body cells, they start killing the other, simply because they think they are foreigner or strange cells. Now, to understand this, how does autoimmune disorder relate to vitamin B12 deficiency anemia? Let's talk about the absorption of vitamin B12. Now, the point is, right from the stomach, now, we have a cell in the stomach. And this cell is called parietal cell. Parietal what? Parietal cell. Now, this is the point. You see, when you take in vitamin B12, with what? With B12, what happens to it? This parietal cell, this vitamin B12 cannot go anywhere. It will not be useful until what? Until parietal cell releases something called intrinsic factor. So it releases a glycoprotein called what? Intrinsic factor. You know, it is still the parietal cell in our last class that releases HCl. That is just reinforcing your knowledge and trying to remind you of things you've known before about stomach. You know, the stomach has things like the parietal cell releasing what? Intrinsic factor and HCl. You have things like the chief cell releasing things like pepsinogen. You have things like the mucous neck cell releasing mucus. So the one more cell we have there, I looked at you. So the point is that this parietal cell now, it can also release something called what? Intrinsic factor. Now, let's assume that this is a picture or the diagram of intrinsic factor. So let's say this is the intrinsic factor now. Now, what do you have to know about this intrinsic factor? What intrinsic factor does is that it binds with what? With vitamin B12. Let's say this shape is a vitamin B12. So vitamin B12, it binds with what? With this glycoprotein called intrinsic factor. And now, together, what they do is that they start moving, and mainly they get absorbed in the ileum, and then that takes them into the what? Into the blood stream. So the point is, they get transported now, or they get absorbed into the what? Into the bloodstream together. Now, bloodstream. So the point is, this is the IF, the intrinsic factor, and this is the what? It's B12, vitamin B12. Now the point is that, what is the function of this B12? The function of vitamin B12 is that vitamin B12, it helps in progressing the what? The growth of what? Of red blood cell within the bone marrow. So the point I'm trying to make here is that when vitamin B12 reacts with what? With thermocytoblast, not even hematoblast, it attacks it at the stages, things like the myelin stem cell, things like when it's actually trying to convert to red blood cells, things like the pro-erythroblastic level, the early erythroblast, the late erythroblast. That is when what? This vitamin B12 works. But what does vitamin B12? What do you think it does? What vitamin B12 generally, what they do is that they help in DNA maturation. In what? DNA maturation and condensing. And what? Condensing. What is the meaning of that? B12, vitamin B12 rather, it helps the DNA to mature. Now, when the DNA matures, it allows for what? For condensing. And when things condense, what do you think happens? Will that thing get smaller, or do you think it gets bigger? If something condenses together, do you think that thing gets small or bigger? Now, the point is, let's see. Okay, good. These are my 2 feet now, right? Now look at the sides. And now if I do like this, I condense together. What happens to the sides? Smaller or bigger? Which one takes up more space? This one I do like this. Take a look at it. Be careful, guys. Well, let me do like this now. This one, look at how big this place is now. Compared to this now. Which one do you think is bigger? Which one do you think is smaller? When they are separate, it is bigger. But when it happens like this, what happens? It gets smaller. Now the point is, this size is when the red blood cells are dividing. They are somehow large. And the point is, as they keep on progressing and as they keep on developing, their DNA and some other structure, genetic materials, they get condensed within them. And it gives them their small normal shape and not too big. But the point is, when vitamin B12 is not able to maturate the DNA and is not allowed condensing to occur, what do you think happens to the size of the red blood cell? It is going to be large. Because the components are not what condensing. And that makes vitamin B12 characteristic macrocytic. Macro what? Cytic. Macro means large. Cytic is from the word cell. As simple as that. So, I actually jumped the gun. So, I fast forward to all this place. I'm not supposed to be here yet. We are still talking about the causes of what? Of vitamin B12 deficiency anemia. Now, I said one thing that can cause this is autoimmune disorder. Right? Cool. Now, how? You see, in autoimmune disorder, we have some cells in our body. Some what? Some cells. And what these cells, what they can do, is to release things like antibodies. Anti what? Antibodies. Now, they can do 2 things actually. The first one is they can release what? Antibodies. What do you think these antibodies will do? You see, this is the vitamin B12, and it's meant to bind with what? With the intrinsic factor active, right? But these antibodies, they will run to this place, and they're going to bind with the what? With the intrinsic factor. And when they bind with the intrinsic factor, and this what? This vitamin B12 is coming down later. Vitamin B12 will have to wait outside, simply because the position has been occupied by the antibodies. And if vitamin B12 cannot bind with intrinsic factor, it means this vitamin B12 will not be getting absorbed into the bloodstream. And if it is not getting absorbed into the bloodstream, it is not going to be used for the what? For the maturation of DNA and condensing of what? Of genetic material. And that is going to make what? Make the red blood cells what? They are normally large macrocytic cells. Now, that is not the end. You see, the point is, apart from the fact that these cells, they can release antibodies that will bind with the what? With the intrinsic factor. So hereby taking away the space for what? For vitamin B12. Another thing they can do is that they can actually just run down here and do what? They just destroy. They do what? They're just going to cut off. They destroy the what? They destroy. They can destroy the what? The perimeter cell. So they can just what? They can just kill the perimeter cell. And the perimeter cell will not be able to even produce intrinsic factor. And when intrinsic factor is not there, the vitamin B12 is going to be useless because nothing is taking it down into the what? Into the bloodstream. As simple as that, guys. Now, if that be the case, which type of anemia can we talk about again after this? Another thing that we can talk about is the sickle cell anemia. So, let me just divide the board right here. Sickle cell anemia. I think I'm running out of marker as an ink rather. So just give me a moment to change these guys. So I'll be right back. Yeah, welcome back, guys. Now, the point is that the sickle cell anemia, sickle cell anemia, sickle cell anemia. So, what about that? For the sickle cell anemia, this is what used to happen. You see, we said we have some what? Some chains of hemoglobin. Remember, guys? So, the chains of globin. You see this globin, this chain, if I what? If I happen to just what? Unfold it to form a straight line. We have series of amino acid on them. Series of what? Amino acid. Series of amino acid. And now, this is 1, 2, 3, 4, 5, 6, 7, 8, and so on and so forth. The point is that, you see, normally, on this 6th chain of amino acid, this is an amino acid, amino acid. On this 6th chain of amino acid, this guy is called glutamic acid in normal human beings. Apologies, I mean, in people that has no sickle cell anemia. So glutamic what? Glutamic acid. So I have to make that very clear. So no discrimination, guys. I mean that. So it's actually a slip of tongue. I can actually say it's a mistake. So people will not just be taking meaning to a slip of tongue. So after that clarification, this is your issue if you choose to say so says this. So normal human being, the problem. Apologies, please. Now the point is that on these 6th chain of amino acid, on a normal what? Hemoglobin. So the normal hemoglobin chain. The point is that the amino acid there is called what? Glutamic acid. But for people who have anemia, what happens here is this. Watch out. I have this chain 3, 4, 5, 6, 7, 8. As usual, this is 1, 2, 3, 4, 5, 6, 7, 8, and so on and so forth. You see, on this 6th chain of amino acid, instead of them having glutamic acid, this place has been changed into what? Has been changed into valine. So it's some sort of things like we have the essential amino acid, non-important amino acid. So this is being changed for a non-important one or a non-essential one. As simple as that. And if you notice the word change here, that is telling you that sickle cell anemia is not something you can be saying it can be caused by eating some kind of food or doing some kind of things or not eating some kind of nutrient like all these guys. So what causes is the change? And that is what we call mutation. Mutation. As simple as that, guys. Now, what is important for you to remember? Now I told you that you have some anemia that you treat specifically. Part of it is sickle cell anemia. Part of it is things like hemolytic anemia. So the point is, we deal with them separately in separate videos. But I cannot tell you when I'm going to do that. So, just for the sake of passing exams and understanding what this thing means in depth for now, being able to attack objective questions. So things that you can actually ask are these kind of things, like a sickle cell anemia, which what are the amino acids that got exchanged? So those are the answers spiritually of them. Now, guys, the point is that mutation, when it happens, a change in the glutamic acid for what? For valine. Now, what happens to these kind of people? This is what happens to them. You see, due to this mutation, due to this what? Due to this mutation, the hemoglobin is going to be what? It's going to be sickled. It's going to be what? Sickle shape. Sickled what? Sickle shaped. Sickle shaped. And the question is, what is the meaning of sickle shape? We have a farm instrument called a sickle. It looks like this. So this is the handle, and this is the metallic part, which is the sickle. So the point is that whenever, now listen to this sentence, guys. Whenever people with what? With sickle cell anemia, whenever they are in a place with adequate oxygen supply, they can breathe in good oxygen. You see, their red blood cell has a normal what? Has a normal biconcave shape. So far their hemoglobin are binding with what? With oxygen. It's saturated with what? With oxygen. But guys, you see, the moment oxygen starts getting out, all their red blood cells doesn't have enough oxygen within them. That is the only time when their red blood cell used to get sickled. It becomes something of this nature. Their hemoglobin will change into a sickle shape like this. As simple as that. So, and when the hemoglobins, when they condense together, it's not back to depart for more plots. The point is the shape they form is a sickle. And that is why they call it sickle cell anemia. Now, a question at this junction. People suffer from sickle cell anemia. What kind of reduction do you think they have in their red blood cell? The quantity or the quality? It's actually the quality. So the point is that, let me come back one more time. What happens in sickle cell anemia is that glutamic acid, it got changed with what? With valine in mutation. The point is, and when this mutation occurs, in the absence of what? Of oxygen. Whenever there is a reduction in oxygen, when oxygen is not binding with the hemoglobin of what? Of the sickle cell anemia patient, the point is that their red blood cell, the hemoglobin within them, is going to be getting condensed and forming a sickle what? A sickle shape. But guys, what do you think this kind of thing can cause in the vascular system? That is in the bloodstream. You already know that if an artery is going straight up like this, it's going to carve up the smaller branchings, arterioles, and later smaller branchings, capillary bed. The point is, when the blood cell is sickled, it can actually occlude the what? It can occlude the blood vessels, the tiny arteries. And simply because they are occluding the blood vessel, we call that vaso-occlusive crisis. Vaso-occlusive what? Crisis. As simple as that. That can damage a good deal of organs within them. And they might need a transplant. We focus more on sickle cell anemia in some other videos. But for now, it's actually good knowledge for you to have about it. So now, let's move to another thing, like the aplastic anemia. So, I'll be right back, guys. Yeah, welcome back, guys. Now, talking about the aplastic anemia. Aplastic anemia. Aplastic anemia. Now, you see, aplastic anemia mainly affects, not so many, only affects, solely affects the bone marrows. So, bone marrow. So, within the bone marrow, we have some kind of cell called the hemocytoblast. Hemocytoblast. You see, in aplastic anemia, the bone marrow is destroyed, coupled with anything inside it, like the what? Like the hemocytoblast. So the question is, what are the causes for aplastic anemia? Things that can cause destruction or that can affect the bone marrow. That is what causes aplastic anemia. So we have different kind of disorders, or even bone marrow disorders, strictly now. Bone marrow disorders can actually cause what? Aplastic anemia. Because when the bone marrow is destroyed and the cell within it is destroyed as well, the point is, you will not be able to form enough red blood cell, and the quantity of the red blood cell is going to what? Is going to reduce. Now, apart from that, other things that can actually destroy the bone marrow are things like radiation. What? Radiation. Some kind of drug can actually depress the function of the bone marrow. So, some kind of drugs. So, drugs. Or you can also say chemotherapy. What? Chemotherapy. So, apart from that, you have other things like X-rays. So, all the rays can actually invade the bone marrow and destroy it. They can enter the core of the body and destroy some certain things. So, things that we mentioned around here. Drugs like chlorphenicol, streptomycin, all those things can actually depress the bone marrow. Now, not to stress yourself too much. The point is, if someone has aplastic anemia, what can be the sign and symptom for that? So things we've mentioned before can actually occur. Because you're not actually producing what? You're not producing any red blood cell. And remember that hemocytoblast is the one responsible for producing things like what? Red blood cell that we're dealing with correctly, the white blood cells, and things like what? The platelets. Now, if they have been depressed, the hemocytoblast, the myeloid stem cells, if they have all been depressed, what do you think will happen? It means people suffering from aplastic anemia are going to have a complication that we've known before, like anemia. So anemia. So a reduction in the count of red blood cells, right? The point is, what about the white blood cell? Their white blood cell is also going to drop. And that is going to prone them towards infection, opportunistic infection. So I think I've shown my red mark as well. So the point is, this can actually cause increase in what? Increase in infection. So it gets infected easily because the white blood cells that are meant to be fighting their infection are gone. They are not being produced because the what? The aplastic anemia sets in. The what? The bone marrow has been depressed, destroyed. So that can be the case. Another thing we have right here is what? Is the platelet. You already know the function of platelet is what? Is preventing blood loss. So through coagulation. Preventing what? Blood loss through coagulation. Now the point is, if someone has aplastic anemia, it means the person will not be able to be preventing bleeding. So the person will have things like what? Increase in bleeding. I do not want to use the word again. Apologies, guys. So increase in bleeding. So increase in bleeding. So the person can have things like bruising. So bruising. So we have things like Peter chip. So simple as that, and so on and so forth. So all these things now are going to be the clinical manifestations for someone suffering from what? From aplastic anemia. And because there's going to be a reduction in red blood cell, white blood cell, platelets, the reduction in all these blood cells is actually called pancytopenia, or you say pancytopenia. Anyone you like, pancytopenia. As simple as that. Because their levels are going to drop. The myeloid stem cell producing the red blood cell is no more there. So the red blood cell has dropped, causing anemia. So white blood cells are not going to be formed too. Their level has become low. That is called leukopenia. So leukopenia. So I say leukopenia as you want. And reduction in platelets is thrombocytopenia. Thrombocytopenia. So as simple as that. So but collectively, if you have leukopenia, thrombocytopenia, and anemia, they are all called what? Pancytopenia. As simple as that, guys. So let's quickly end this video with thalassaemia. Yeah, thalassaemia. Thalassaemia. Now, you see thalassaemia, so it's actually not so common. It only affects a certain breed that I've forgotten actually. So the point is, thalassaemia has two types. So, but before that, you see, on hemoglobin, on normal hemoglobin, guys, what happens is that we have 2 alpha and 2 beta chain. These are actually the normal chains. I with me, guys. We even have far more than that. But based on thalassaemia, that is, excuse me, guys. So based on thalassaemia, that is what you need. Even we have hemoglobin F. So I don't want to disturb you. Just on hemoglobin A. The point is, we have 2 alpha and what? And 2 beta chains. Now, in some people, they have 1 alpha missing, and their own hemoglobin only has 1 alpha and what? And the 2 beta. So these are some kind of people. And some other kind of people, what they have on their hemoglobin A is what? Is 2 alpha, which is complete, and 1 beta. The point is that, you see, people who are missing 1 alpha, which is supposed to be 2, they have alpha thalassaemia. Sorry guys. Thalassaemia. So correct that. It's thalassaemia, not thalassaemia. Let's confirm. So you see now, you can guess. People who are missing 1 beta now instead of 2, they have what? Beta thalassaemia. Thalassaemia. As simple as that, guys. So not too much. So if that is all, I think we've done justice to a great part of what? Of anemia generally. So the only thing left for us is pathophysiology. I do not want to go into that without talking about hemolytic anemia, and anemia rather. Although hemolytic anemia is a big topic, it's not our responsibility quite. So let's quickly go into something else. So in our next class, we'll be talking about the production of white blood cell. And the class after, we'll be talking about leukemia. Beautiful. So that's just how I want us to do it. But if you think we should go deeply into hemolytic anemia firstly, just let me know. You can just prepare for that and come with it next. So since you're currently online, things should be a lot faster. So the next time, guys, I wish you the very best. Hi guys.